Well, ultrasound has been really, it's revolutionized my practice over the last 2 years since I started using it. Prior to using ultrasound, I would have to send many patients out for MRIs. I would do most of my injections blindly. Over the past 2 years, I found that I use it in both a diagnostic capacity as well as a navigational capacity to navigate my injections.
Yeah, I can tell you I was not completely sold on the ultrasound techniques until I've started to use it more and more. We have a practice that's confined to just the upper extremity. We do shoulders to fingertips. We have a busy practice. We are a two-physician practice, and basically we have 2 ultrasound machines that are in use almost full time. We each have one in our hallway. We use it for everything from subacromial injections, which are the easiest to do, but things, for instance, like injecting a biceps tendon sheath, difficult to do except under ultrasonic control. You can identify the biceps tendon, we can safely inject it right down the sheath, seeing the sheath fill, and then certainly even in some of the more obese patients where we need to do intra-articular injections, things has been very easy.
In the hand, I use it for carpal tunnel injections as well as small joint injections in the hand. I've diagnosed things as varied as a multilobulated ganglion cyst in the carpal tunnel, which I aspirated. I've diagnosed things like aneurysms in the radial artery, ulnar artery thrombosis. So it's very useful in my practice, and I've found that it's enhanced my patients' care. It's also saved them a lot of money because in many instances where I would order an MRI on a patient, I now order an ultrasound, and I do that at the point of service myself. I feel comfortable doing that, and it saves the patient a lot of time and money because they don't have to go out to get an MRI and then come back for another appointment. We do everything at the point of service now, so it saves them time and money.
We've had our ultrasound machines now for the better part of 2 months and 2 physician practice, and we've done probably on upwards of, I would say, 350 or 400 ultrasounds. With the reimbursement now for ultrasound techniques, certainly those machines will pay for themselves in a matter of months as opposed to a matter of years. And so it's certainly very affordable for most hand surgery practices.